Hi everyone, this is Respiratory Meds Part 2. These are the few meds that I neglected to put on our original list. So you have one big PowerPoint for respiratory meds that you can take notes on, but there are two recordings that cover the material in that PowerPoint, and this is the second one. So the med that we want to talk about first is we want to talk about our upper respiratory tract medications. So these meds affect things like sinuses, nose, congestion, those kinds of things. And our prototype here is diphenhydramine, better known as Benadryl. You guys learned this drug before, so hopefully this isn't totally new to you. As you know, this medication is sold over the counter, and it comes in a zillion different formulations. It could be pills, it could be liquid, it could be cream, it could be ointment. It is used for lots and lots of different things. Its mechanism of action is that it's a histamine antagonist. And remember, histamine is what's released during an allergic reaction. So it's great to treat things like allergy, runny nose, itchy eyes, congestion. It basically dries you up is what Benadryl is going to do. And it dries you up everywhere. So it's going to make you dry-mouthed, dry-eyed, just going to kind of make you feel kind of dried out. So it can also be used for sleep. And we use it for sleep just because of its side effect of drowsiness. So, you know, it doesn't cause major issues for us to use it for sleep, but it really should only be used for short term and not for long term. But all of those, Tylenol PM, Advil PM, those all are basically Tylenol or acetaminophen or ibuprofen along with diphenhydramine, Benadryl. So the adverse effects is drowsiness and dry mucous membranes. People who take hypertension should not take this drug, as this drug tends to exacerbate that. And then when you talk about teaching your patients, you want to make sure that you tell them, don't take this medication and drive or operate heavy equipment. So this isn't really a great drug to take like during the day and go to work. It would make it really challenging to do that. Okay. The next prototype we're going to look at is what's called a second generation antihistamine. Now, I don't know if you remember your discussion of generations in your first pathopharm class, but generations mean sort of like the newest model or the newest version of the drug. And usually what happens is that as we get more and more versions, we refine them a little bit so that they have fewer and fewer side effects. So the big antihistamine that's used, and again sold over the counter, is Loratadine or Claritin. And it is an antihistamine, but it's a second generation antihistamine, meaning that it does not cause drowsiness. Now, of course, as you all well know, there are people who, despite that claim, still have drowsiness with it. So you have to be careful with that. But most people can take it every day. This is something you could take, you know, if you suffer from seasonal allergies and it's blooming season, you could take it every day and potentially go to work and be fine. So it's used for seasonal allergies. It can also be used for chronic itching, which is better known as urticaria. And so people might take that if they have like eczema or something like that. Side effects, exactly the same as Benadryl, dry mucous membranes, and even though it's not supposed to cause drowsiness, it can cause drowsiness in some people. People who shouldn't take this is asthmatics, because this medication, just like Benadryl, can really dry out your mucous membranes, which might not be so good if you're having an asthma exacerbation, because then the mucus will be sticky and stuck down in those lung spaces. And then you don't want to give it to anyone with hepatic or renal impairment. The next one is Sudafed, or pseudoephedrine. and the class is decongestant. A decongestant usually helps just sort of break up and drain out what's in your head, and it does that by sort of sopping up extra fluids. So it is a sympathomimetic, right? It is fight or flight, and it reduces nasal congestion by constricting vessels. So you can only buy this over the counter as phenylephrine. You used to be able to buy pseudoephedrine over the counter, Sudafed, but now you can only get phenylephrine. You can, if you still really feel like pseudoephedrine is the best product for you, you can still buy it from the pharmacist without a prescription, but they're going to take your name and they're going to want some kind of ID and they're going to log you in a book because, unfortunately, pseudoephedrine can be used to make meth. And so they want to deter people from just buying it willy-nilly off the shelves and filling their cart up with it. But they don't really care if you buy it over the counter either. It's not like they're going to look at you funny and be like, what are you doing with that drug? Unless you're buying, every box they have. It's used for congestion during an upper respiratory infection. Side effects are tachycardia and palpitations, and that makes sense, right? Fight or flight. If you're like, running from the scary monster at night, you're trying to get away and save your life. This is what's going to happen. Hypertension, CNS stimulation. So the problem with this is causes inability to sleep, and it can make people feel really kind of wired. Along with that, tachycardia and palpitations. So this is a drug that when I would take it for colds, I could never take it after about 4 or 5 o'clock in the afternoon, or I would be up all night, not able to sleep. Contraindications is cardiac arrhythmias, anyone with cardiac arrhythmias, hypertension, or diabetes. And the reason we don't give it to people with diabetes is that it masks symptoms of hypoglycemia, that shaky, kind of feeling, funny kind of feeling, could be hypoglycemia, and we would not want to miss that. Okay, now we're going to move on to cough medicines. And clearly when we talk about cough medicines, we're talking about cough suppressants. So remember, the other term for that is antitussive. And the one that we'll talk about first is dextromethorphan. So dextromethorphan is commonly sold over the counter as Robitussin, and it is called an NMDA agonist, but honestly, we don't know why it works very well. We don't really understand its mechanism of action for suppressing cough, but we do know that it works in the brain. So it's used for cough due to like common cold, and it's probably better than nothing, but it is nowhere near as effective as using an opioid like codeine as an antitussive. Side effects are very few with this drug. It can be a hallucinogen at high doses, which some people then, abuse. So if you have friends that are purchasing dextromethorphan over the counter and using it to get high, that's why. I wouldn't recommend it. I think it can be extremely dangerous to do that. It can also cause nausea, vomiting, constipation. So that would probably come with a high dose as well. The next prototype is codeine. So you really only have 2 prototypes for antitussives. You have basically a non-opioid and an opioid. And codeine is a very mild opioid. Now, what's really interesting is you often see this sold with something like Robitussin, and you're like, why would we put 2 of these together? Well, I think the thought is that if you can put Robitussin with codeine, you can use a little less codeine than you would normally use it if you didn't have the Robitussin. So it's an antitussive pain reliever, but it is an opioid. It's in tiny, tiny, tiny doses. So that risk for abusing is very small. It's still there, but very, very, very small. And it depresses the CNS and works to suppress that cough reflex in the brain. So this is really used for like a nagging, disruptive cough. And like I said, it's almost always combined with dextromethorphan or a decongestant. Rarely is it just given on its own. Codeine on its own is also really hard on the stomach. So you would want to be aware of that. Maybe give patient a little something to eat when they take it as well. But major side effects are drowsiness, CNS depression, constipation, nausea, vomiting. And it should not be used in patients whose cough should not be suppressed. So if you have someone who just has regular everyday, bronchitis or pneumonia, they have infected, mucus, that needs to come up. And so we don't want to be suppressing that. But somebody who's like a COPD person, chronic bronchitis, not to say that we don't want that mucus to come up, but we just know that it's going to be replaced with more mucus, and so then we sort of value sleep over cough suppression. Cough and cold medicines, just some general guidelines. They really should only be used for a short period of time, 5 to 7 days. Symptoms that continue beyond that time should be evaluated by a healthcare provider. So if it's not working or the patient continues to have a cough, there could be something much more serious going on than just a cold, and we would not want to miss that by masking it with cough and cold medicines. You do not want to give cough or cold medicines to children under 3. There are so many combination medications that are sold over the counter that can cause fatal drowsiness. So we really don't recommend them. They're not terribly effective for kids under 3, and the risks outweigh the benefits. And then you want to continue to follow your normal care of cough and cold. I mean, these are not a magic wand. They're not going to get rid of anything. So plenty of rest and fluids, and taking this medication along with that is what needs to happen. And then you want to observe for excessive drowsiness or risk of dependence. Sometimes people use cold medicines just to kind of tune themselves up for, from allergies and other things every day, and they're not meant to be used that way. So something to be aware of. Next, we're going to go to Expectorants Immugalytics, and you only have 2 of these. So the first one is Guathenosin, and it is an expectorant. So you're like, what is the difference between an expectorant and a mucolytic? Well, an expectorant is definitely going to help you get the mucus in there up. It thins the mucus, makes it so that it moves a little easier when you cough, and can help get that mucus out. However, a mucolytic, which we'll talk about on the next slide, it actually breaks bonds within the mucus itself, which helps break it up and get it out. So they have different mechanisms of action. Guathenosin, better known as Mucinex, works by drawing water into the mucus, which increases volume and viscosity. And so it helps a lot with getting that mucus out. It's used to help patients cough up thick mucus. It can also assist with sinus drainage because it's not particular to which mucus it thins. So it can be helpful there. Side effects are nausea, vomiting, and it can actually cause kidney stones, which is kind of interesting. You don't want to use it in children under the age of 6, and almost all cough, cold, over-the-counter medicines have guaifenesin in it. I think it's really interesting. You'll see a lot of times where you'll have like a dextromethorphan and a guaifenesin together. And my question to you is, does that make sense? Should we give an expectorant with a cough suppressant? And I would say no. Last but not least, we have Acetylcysteine, better known as Mucomist. It is a mucolytic. It is a mucus buster. It splits the disulfide bonds in mucoproteins and lowers mucus viscosity, resulting in a larger volume of sputum. It's used for emphysema, bronchitis, cystic fibrosis, asthma. And then the other really interesting use for this particular drug is it is used to treat overdose of Tylenol. So that's probably where I've seen it used the most, is Tylenol overdose treatment, but it can be used for these other respiratory issues. It smells like rotten eggs. It's so gross when you smell it. And I would think that for a lot of people, between the smell of rotten eggs and then coughing up lots of mucus, that's kind of a recipe for vomiting right there. And surprise, one of the side effects is nausea, vomiting. But it could also irritate an underlying chest condition and cause chest pain, trouble breathing. So it's something that you'll want to watch for. Okay, my friends, that's it. We are done with part 2 of the respiratory medications.